Hello, today we are supposed to talk about the IBS and IBD. You guys might be getting that it is actually about the bowels, inflammatory bowel disease and irritable bowel syndrome. So we are actually going to talk about the bowels, okay? So we have two main problems or complications regarding the bowels. One is IBD, another one is IBS. One is called as inflammatory bowel disease, and another one is called as irritable bowel syndrome. Now, what is the basic difference between these two? So let's know that by means of 1, 2, 3, 4, 5, 6 points for each. Okay. The very first point for the IBD is definition. What is the definition of the IBD? Inflammatory bowel disease. Simple definition. It is chronic inflammation of the digestive tract. So we have digestive tract. If we get chronic type of inflammation over there in the digestive tract, then that is called as inflammatory bowel disease. The name is telling you guys, inflammatory means having inflammation. Where? In the digestive tract. So specifically targets are the colon and the small intestine and as well rectum. So we can see that in short in the intestinal regions. Okay. So we have two types basically of the IBD, chronic Crohn's disease and ulcerative colitis. So in Crohn's disease, basically the small bowels and colon are actually affected, and whereas in the ulcerative colitis, colon and rectum, these two are the basic portions that are affected. Then we have cause. Immunity is the very basic cause of this particular IBD. And some genetical factors are also responsible, and so as environmental factors. So now what are the signs and symptoms? Simple: abdominal pain, diarrhea, weight loss, fatigue, and etc. can be observed, okay, in IBD patients. So basically there is inflammation in various parts of the GI tract. So how this happens actually is our immune system actually takes our GI system. So our digestive tract system, okay, basically our colon and small intestine. So when our immune system attacks, so then that results into inflammation. So when we observe that through proper diagnosis that inflammation is actually seen, then we suggest that the patient is having IBD, inflammatory bowel disease. Okay. So what is the treatment strategy now for the IBD? Very simple. Biologics. We have certain biologics that are actually used for the treatment of the IBD. We have immunosuppressant medication, corticosteroid, lifestyle modification, and if there is a chronic type of the inflammation, so surgery may be suggested then. We have another one, that is IBS, irritable bowel syndrome. The name irritable bowel means the bowels are actually irritated. Definition is actually telling you guys more about the IBS right now. What is the definition now? Definition is actually this IBS is the disorder that interferes with the motility of your digestive tract. So what is the motility? The normal motility. Okay. Normally a person defecates. I have mentioned this in my other videos that a person defecates for about 2 to 3 times. Okay, in a day. What happens now if this normal routine is actually fluctuated or being changed? You feel so less or you feel so high in number. I mean, you're going too frequently to the to do the bowels. Means you're visiting the latrine or the washroom or the bathroom, whatever you call that in your language. If you visit that time and again, so your frequency is so increased or so decreased. So then that is actually telling you that you are having actually IBS. Okay, irritable bowel syndrome. Now actually we have two types of the irritable bowel syndrome. One is called as IBS-C, another one is called as IBS-D. Now what is IBS-C? Simple, irritable bowel syndrome constipation type. In this we have a patient who is complaining constipation, and IBS-D is a patient having or telling us that a patient is having diarrhea. So let me tell you in signs symptoms more further, then we will come back towards the causes. Now regarding signs symptoms, generally we have altered bowel habits, like we feel abdominal pain also, and we feel bloating. So well, coming towards further specification with respect to the patients, IBS and IBS-C and IBS-D. Now I'm explaining the signs and symptoms with respect to the IBS-C and IBS-D. We have two types of patients. One having complication of diarrhea, another having complication of the constipation complication, diarrhea complication. Okay, constipation, diarrhea. Now in case of constipation, a patient feels that as I eat, so my eating disability, my eating problems include bloating, so I feel bloating, constipation. Then after that I feel abdominal pain, and as well when I go for defecation I feel a kind of incomplete evacuation. So I cannot do complete bowel So I feel that there is a kind of remnants available in the bowel, so that I've not done a good bowel. Means I don't feel okay, I don't feel empty. So there is a kind feelings in the body that I still need to defecate. So but still there is a kind of stuff available in the body. So incomplete evacuation, abdominal pain, bloating, constipation, you will be seen in the IBS-C patient. A patient have feeling observing or coming with a constipation. So the bowel movements are so often decreasing this. Okay, why? Because feeling patient is feeling constipation. That's why the bowel movements are actually decreased. Okay, so that is the very point that brings the patient to the hospital or to the healthcare professional for the treatment. That the patient is complaining the bloating and pain and abdominal pain, constipation, and incomplete evacuation. The very basic signs and symptoms, and there are some certain other signs and symptoms available also. Okay. Well, regarding IBSD, inflammatory bowel, not inflammatory, irritable bowel syndrome, which one? Diarrhea type. Now, in this, what are the signs and symptoms? Again, abdominal pain will be there, but there is another complication, that is urgency. Means a patient feels that urgency of the defecation. So, patient will move for the defecation, and there will be again frequent. So before, if a person is normal person will go for defecation 2 or 3 times a day. But when it is about the IBS, in irritable bowel syndrome patient, which one? Diarrhea type patient. So that patient will go so often to the for defecation, and frequent bowels will be there. So in short, in them, and they will feel urgency, and along with that, they will feel abdominal pain. Guess what? Abdominal pain in both the types, whether it is IBS or IBD, IBS-C or IBS-D, the abdominal pain will be decreased, or you can say a kind lost, when the patient moves for the defecation. So defecation is a kind of remedy for them. And well, now let's come towards the cause. The exact cause for both is not now, but the mental health plays a very important role hereby. So we can say mental health is also a problem or a cause for this particular IBS. And we have sensitive intestine. So in some patients, this intestine is so sensitive, because of which they may have IBS. So we got the symptoms. Now let's come towards the pathophys. So well, regarding pathophysiology, simple. I showed in the beginning, it is actually the connection. The mental health plays a very important role, and this is actually the problem of the brain in the gut dysfunction. So our brain and gut axis is actually a kind now not going to work properly. So there is a kind of dysfunction in the brain and gut. Okay, so this communication is actually disturbed, and that actually then lead towards the bloating, constipation, diarrhea, abdominal pain, frequent bowels, abdominal pain, and incomplete evacuation types of symptoms in a person. Well, then what is the treatment of this? Simple. Mental health plays a very important role. So the treatment strategy is, first of all, stress management. The more easily you manage the stress, the more easily you will recover yourself and the patient. Well, diet plays an important role again here by lifestyle modification, and somehow the very important aspect of this type of disease, that is actually inflammatory bowel syndrome. So this can be treated by the psychological therapy. So psychological therapy plays a very important role in IBS. Okay, so that's all from my side regarding the IBS and IBD. I hope you got. If still have confusion anywhere, feel free to ask us in the comment box. And thank you for watching Dr. UUT lectures.